And that love from coast to coast, planting them seeds so you know we growing, believing in us, damn right we know when. Ain't got time for the stress and pain, no time for hate, no time for games. It's time to take it up, take it up, we gon' take it up. Hey.
Real talk for real life. Real talk for real life. Welcome to Real Talk for Real Life. I am your host, Sherri Ann. This month, we're going beyond the pink in honor of Breast Cancer Awareness Month. Breast cancer is more than a color or a campaign. It's about protecting our health, breaking down those barriers, and making sure every woman has the knowledge and the tools needed to make the best decisions when it comes to her health. Today, we have a lovely, and dynamic guest, Miss Lisa Saintil. She is here to educate us regarding breast cancer and breast health. We're so excited to have her. And this is her third year being with us, so we're even more excited because Miss Lisa Saintil comes to educate and to inform us so that, again, we can make the best decisions when it comes to our breast health. But before we get to that dynamic lady, you all know I have to let you know that Real Talk for Real Life is being brought to you all today by Women of Dynamic Change, a 501c3 nonprofit. And our mission is to break down those barriers that keep women from being able to reach their full potential, whether it be mental, spiritual, or physical. We're here to provide the education, the resources, the knowledge, the tools, the connections, the networking opportunities, and more importantly, the support that every woman needs to be able to rise and to become the best version of herself. Ladies, you're superheroes, and I tell you this every episode of Real Talk for Real Life. Once we discover what our superhero powers are and we understand how to operate them, there is nothing that we won't be able to accomplish, and even more so when we unite with other women who understand their superhero powers. Man, we can be so dynamic together. And I always say you can accomplish more as a team than you can alone. And let's not forget about that faith, ladies. Listen, you got to have that mustard seed. It's a part of the treatment plan. Have that mustard seed of faith. And I'm telling you, it is going to allow you to be able to get through so many obstacles and so many challenges. And so we're going to get to that lovely lady, Miss Lisa Saintil. I want to say thank you again for being here today with us on Real Talk for Real Life. I am so looking forward to this conversation, and I want you to go ahead and let the world know just how dynamic you are, Miss Lisa Saintil. Go ahead and introduce yourself.
Thank you, Sherri Ann. Hello, audience. My name is Lisa Saintil. I am a board certified nurse practitioner, family nurse practitioner, specializing on cancer genetics, oncology genetics. And it's a privilege, as Sherri Ann mentioned, it's my third year here talking about a very important topic. It's Breast Cancer Awareness Month, and I'm so excited to share some very valuable information with you all.
Yes, definitely. So we'll go ahead and get into this crucial topic of breast cancer. So this year we talk about pink, right? Going beyond pink and why it's important to go beyond pink. And when I think about going beyond pink, I think about taking action, right? So Miss Lisa Saintil, what are some of the actions that we can take to protect our health and prevent breast cancer?
So you touched on a very important topic is we need to go beyond pink, right? We hear about Breast Cancer Month and we see pink everywhere. But some actions that we can take is first and foremost is going in and getting our annual physicals in, right? Going to see your primary care doctor, whether you see a nurse practitioner, physician assistant, it's very important that you're going into your annual visit so you're making sure you're getting the appropriate age and gender appropriate screenings. That helps us identify if there is an issue, such as breast cancer. Other thing is also knowing your risk, maintain a healthy lifestyle, all of which that I know that we're about to touch on.
Yes, definitely. So let's go ahead and get into it because one of the statistics that I definitely want to let every woman know is that 1 out of 8 women will be diagnosed with breast cancer at some point in her life. So again, this is a much needed topic for us to be discussing today, especially with Miss Lisa Saintil. So what are some of the most important risk factors that we should be aware of when it comes to breast cancer?
Yeah, unfortunately, that statistic still stands true to this day. 1 in 8 women will develop breast cancer in her lifetime. And so, risk factors to keep in mind, first and foremost, would be a family history of breast cancer. So, women who know that there's members of their family, both male and female alike, who've been diagnosed with breast cancer, that's considered a risk. Primarily, if you have women in your family who have been diagnosed with breast cancer age 50 or younger, or maybe you have more than 2 women on one side of the family who've been diagnosed with breast cancer and maybe not know exactly how old they were. And when we say one side of the tree, that would be an example of your mother, your grandmother, or maybe an aunt on that side, your maternal aunt with breast cancer, or maybe a sister. Other risk factors would be having dense breasts. So, having dense breasts by itself is not what increase a woman's risk for developing cancer, but more so that having dense breast tissue can make it difficult for a radiologist to read your mammogram. So it can kind of hide in a mammogram, so not being able to view. Another very important risk factor would be having a family history of a known genetic mutation. So, meaning that someone in the family has tested positive for a gene that's known to be associated with the increased risk for developing breast cancer. Examples of some genes that are related to increased risk for breast cancer would be BRCA1 and BRCA2, which are very common. Tend to hear about those more often in the community, known as BRCA1 and BRCA2. But I also want to highlight some additional genes that are equally as important compared to BRCA1 and BRCA2, and that would be PALB2 or PALB2, ATM, CHEK2, STK11, and there's a few more. But I just wanted to bring awareness that beyond BRCA1 and BRCA2, there are also additional genes that are related to high risk for developing breast cancer. So if a woman knows that a member of her family has tested positive for those genes, it's very important she understands that definitely would place her at higher risk and should seek testing.
And see, and that is the importance of having knowledgeable people like yourself and nurse practitioners come on Real Talk for Real Life to educate us, because every year there's changes, right? Through research and through new findings, there are new things that we need to know about. And so thank you again for providing that information, because I just learned something new myself. So thank you for that. Now, let's get into genetic testing. We'll talk a little bit about that since you spoke about genetics and the importance and how easy it is to get genetic testing.
Yes, it's very important. Genetic testing, unfortunately, is not something that too many people in the community hear about, right? So, the idea of genetic testing is having the understanding that there are some families who, unfortunately, to no fault of themselves, they just have a higher risk for developing certain cancers. In this case, we're primary focusing on breast cancer. So this simply means that that individual was born with a genetic change, which is called a mutation, in a specific gene that's known to cause an increased risk for developing breast cancer. So nothing they could have done to prevent it, but it gets passed on from either mom or dad and would place them at a higher risk for developing cancer. As far as access for genetic testing, oftentimes a patient would see a genetic specialist, whether it's a genetic counselor, a geneticist, or even a nurse practitioner who specializes in cancer genetics in order to get tested. That may be prompted by their primary care, sending them a referral, or in today's time, sometimes the patient, if they have open access with their health insurance, they can actually make contact or reach out to a genetics provider directly to get that done.
Okay, awesome. That's very important information for us to know for those who have family members who have had breast cancer. Definitely is so important to get that genetic testing. And I'll tell you, just I shared with you all last year about my personal journey with it. I have a mom who was diagnosed with breast cancer twice. And one of the things that they did suggest for me is to get genetic testing. And I put it off because of fear. I put it off for years, as a matter of fact, but I went in and did what I needed to do and got the findings and found out what I'm susceptible for. And thank God everything turned out okay. But it's better to know. I always encourage women, it's better to know so that you can make decisions early on instead of waiting to the point where, you know what, we may be in a position where we'll get unfavorable, right? An unfavorable diagnosis or outcome because we waited or because we didn't take the time out to get tested. And so thanks, Lisa, for that. So let's go ahead and talk about some signs and symptoms, right? So what should the ladies out here be looking out for when it comes to our breast health and what our breast should look like and feel?
So, signs and symptoms. The first thing is it's very important for women to really get to know their breasts, right? That's what's really going to allow you to identify those signs and symptoms. So, you need to know what's normal for you in order for you to identify a lot of these signs and symptoms that I'm going to share. So, the first would be an actual lump, right? So, feeling a lump within your breast would be considered a sign that you do want to bring to the attention of your healthcare provider. Also, would be an inverted nipple. If you naturally have inverted nipples, this is not that example. This is for the woman who didn't have an inverted nipple, and all of a sudden she noticed that one or both of her nipples are inverted. Other signs would be changes in the skin of her breast. So maybe she notices that the around her nipple area or the side of her breast that the skin has changed. It's thicker. It may even have the consistency of like an orange peel. Another concern would be like crusting of your nipple, right? Or even having discharge from your nipples. This can be bloody, this can be yellow, this can be clear. All signs that a woman should definitely bring to the attention of her healthcare provider. Other signs can include maybe changes or engorged vein of her breast, maybe puckering or feeling or seeing as if someone is pulling the skin of her breast from the inside. All are signs that would need to be addressed. And of course, pain.
So one of the most important things that I hear you say is for women to become familiar with their breasts, because I've heard stories of where certain women found their breast cancer through their spouse, finding it and feeling a lump. And so we have to know what our baseline is and what our breasts look like and what they feel like in order for us to even know if there's any changes, right? And so it's important to get comfortable, right? So that brings me to talk about the breast self exams. When should we be performing our breast self exams?
So when it comes to breast self-exams, the most important thing is consistency. Usually I'll tell a woman that pick a day out of the month that she remembers and to do her self breast exam that same day each month, whether it's in the morning, whether it's in the evening, pick a time of the day, a day of the month, and a position that's most comfortable for her and do that each month, right? That tends to be an easier way for a woman to remember to do her self breast exam. Another option would be for a woman to perform her breast exam on day 7 to 10 of her menstrual cycle. So, just so our audience can get a refresher, so day 1 of your cycle would be the actual start of your period or your menstrual cycle. And so you will count to day 7 to 10. And so that would be the time period to actually perform your breast exam. So either two of those options would be considered ideal or sufficient when it comes to self breast exams.
So let's get into talking about screenings. Let's talk a little bit about mammograms. So what is the new research when it comes to, mammograms, and what should we be going forward to ask our physician to write us a prescription to get our mammograms performed?
So the average woman should start her mammogram screenings or her breast cancer screenings with mammograms beginning at age 40. Now, there are women who would need to start sooner than that. It's all based off of their own family history. So, meaning if they have a close female member of her family that was diagnosed with breast cancer at a young age, typically younger than age 50, the guidelines recommend that the members of her family, close members of her family, let's say if it's a mom, right? So her sisters and her daughters, if she has any, they should start mammogram screenings 5 to 10 years younger than the age that she was diagnosed. So the easy, quick answer would be age 40, and the more detailed answer would be depending on one's family history. If there's a young age of breast cancer before age 50, 5 to 10 years before. As far as how to go about getting a mammogram, Initially, it's typically should be offered to a woman when she goes in for her annual physical, whether it's her primary care or her well woman exam, if it's her gynecologist. And so, based off of one's age and family history, that should be a pretty much a routine plan of care or prescription that's given to her by her healthcare provider. And if that's not being done or it hasn't been initiated, most definitely we empower women to initiate that conversation with her healthcare provider and simply state, I turned 40 this year. I think it's time for me to have a mammogram, or when you think I should start. But simple answer would be 40, as I mentioned, for the average risk woman. And if she does have a young female in her family member with breast cancer before 50, 5 to 10 years before that age.
And that's what we talk about, being proactive when it comes
Yes.
to, right? Definitely being proactive when it comes to your health. I want to talk a little bit about this because this was an experience that I had. What is the difference between screening mammograms and diagnostic mammograms?
Very good question. I think that's the first time we've had that question, actually. So, a screening mammogram, typically the radiologist technician would take two pictures or two views of each breast. And so, the purpose of that is exactly what the name implies, to screen for abnormalities of the breast. Whereas a diagnostic mammogram, you would go in for a specific reason, a specific complaint that maybe the patient is having, or an area of concern that has been identified maybe from a screening mammogram that was done prior. So with the diagnostic mammogram, there are more pictures that are taken. The idea behind a diagnostic mammogram is you want to flatten the breast as much as possible in order to take more pictures of an area of concern or area of interest. It's very important to note that both of the images are equal as far as the quality. Screening mammograms are usually just two pictures that are taken of each breast, versus a diagnostic mammogram where more pictures are taken specifically because of area of concern. The clarity are the same both with screening and with diagnostic.
And the reason why I brought that question up, Lisa, is because I had, like I said, my own personal experience with that. I went for my regular checkup, and of course, my doctor, gave me my prescription for screening mammogram. But when I got to the breast center to perform the mammogram, you have that checkoff list, and they ask you, have you felt anything abnormal? And at that particular time, I was feeling some soreness in the breast, and so when they saw that, they were like, we we need a diagnostics screening a prescription, because that just regular screening mammogram is not going to get it. We need to take more pictures, and we need to be able to find out exactly what's going on. And so I just want to mention that, ladies, that when you go in to see your doctor, and if you are having any type of pain or feeling something abnormal, be upfront and honest and let them know so that they can write the correct prescription. And so you won't be delayed when it comes to getting your mammograms. So, Lisa, let's talk about lifestyle choices. Okay, I want to get into that because there are some things that we can do to lower our risk for getting breast cancer. So, what some of those things be?
So, some of the things that we can do to really help us lower our risk for breast cancer would be, first thing is maintaining a healthy weight. So, that would require us to be very mindful of our weight, to be very mindful of physical activity. We do know being obese or overweight does put women at higher risk when it comes to breast cancer development, especially women who are in their menopausal state or menopausal age. So at least exercising 30 minutes a day, 3 days a week, being very mindful of your weight. Another thing to keep in mind is know your vitamin D level. Most recent research has shown that women with lower or below average or below normal vitamin D levels can be associated with an increased risk when it comes to breast cancer development. Also, keep in mind when it comes to your alcohol intake, right? So, the recommendation is no more than 2 to 3 alcoholic drinks per week, as it is known that increased risk for breast cancer includes high alcohol intake. So if you have a person who's drinking more than one drink a day, that is associated with an increased risk when it comes to breast cancer development. Same would go with smoking. So smoking cessation. So meaning if you are a smoker, please be very active in quitting smoking. There's resources available when it comes to that, but smoking does increase risk when it comes to breast cancer development.
You mentioned exercise.
I know.
Exercise, right? And exercise is something that many of us women struggle with. But you said something else important, 30 minutes a day. I think we could give that to ourselves. We can commit that to ourselves where we go out and just walk, right? You can walk
Yeah.
outside, and guess what? When you're walking outside, guess what you're getting? You're getting that good old vitamin
Yes.
D.
Absolutely. Absolutely.
Right? So you're being able to handle two things at once. And so that
Mhm.
exercise, and now you're getting vitamin D. So it's just it's a part of commitment to yourself. It's a part of self-care. So thank you, Lisa, for that information. I want to talk about advocating, and we mentioned a little bit about that before, advocating for yourself when you feel like you're not being heard. So what are some of the things that you tell your patients when it comes to their health, their breast health, and how they can advocate for themselves?
I always tell patients to speak up. Going in for your health visits, your appointments, it's a two-way communication, right? You're not there just to be a body and not participate. It's very important for women to be an active participant when it comes to their health, which means having questions, being engaged in their doctor's appointments. And there are instances, of course, where patients will share that they feel like they're not being heard. And in those instances, I empower women to seek second opinions. Reach out to your network, whether it's family members and friends, and find out whether or not they have recommendations of providers that you can see to get a second opinion. Other ways of advocating for oneself, I usually will encourage patients to bring a support person. We tend to think of doctor's appointments as just me and that provider, right? But there's times where you need additional support. So not being afraid to reach out to a spouse, a friend, a parent, an adult child to accompany you at your doctor's appointment where you can maybe feel that support or have that person on hand to kind of intervene and know what concerns and wishes you have that in that moment in time maybe you just draw a blank, right? But
Yeah.
because you may have had prior conversations with them, they can kind of chime in and bring those concerns to light. So those are just a few ways I would typically encourage patients, women alike, to advocate for themselves.
I love that support, and it's nothing wrong with needing support, ladies. And that was something that we touched on Real Talk for Real Life last month. Is that saying that you need support and someone just to go with you to a doctor's appointment doesn't make you weak, right? And in fact, it
No,
makes you right because I think some
no,
women feel like I can't do this alone, and then it's okay if you can't do it alone, right? This is
no, right.
it's scary, right,
It
Lisa?
is. And sometimes women and men, but women do, you just kind of draw a blank, right? Women
Yes.
oftentimes are the advocate, the head for everyone else, right? So if it's their
Yes.
spouse that has a health issue, they're front and center. If there's their child that has a health issue, they're front and center. It's not unknown that when it's you, right, you're the one
Yeah.
affected that you can't even advocate for yourself because you're in shock or you just draw a blank or you're just not used to having to advocate for yourself because you're advocating for everyone else. So absolutely, there is no shame, shouldn't be any shame when it comes to needing someone to be there to be your support person or to have someone else be the person that advocates for you because sometimes in the heat of the moment you just go blank.
Yes, and
Right?
I've seen it happen. So it's okay to say, I need support, ladies. So let's talk about disparities when it comes to women of color. Have you seen disparities? And let's get a little bit into more about what those disparities may be, Lisa.
So, when it comes to Black women and breast cancer, disparities would consist of we do see that Black women come in with oftentimes more aggressive breast cancer, oftentimes in more advanced stages. Current research doesn't necessarily bring clarity as to why that is, but that's just something that it is seen that that we are seeing, which is Black women with breast cancer tends to have more aggressive forms of breast cancer. And when they do come in to seek care, it's usually a more advanced stages. Other questionable disparities, I say questionable, would be access to care versus seeking care. So we know access to care does exist. So whether it is from women who don't have health insurance or don't have providers in their local community. And then we also have women who just they know that something is wrong and they just choose not to seek care. So, not that they don't have access to care, but just willingly, for whatever reason, whether it's fear, whether it's personal choice, just opting not to seek care.
So those are many different reasons why women don't seek care. And so one of the things that I always just try to encourage women in general is what happens if there is something that is abnormal. The longer that you wait to seek medical attention, the outcomes sometimes will be not favorable. So really, you got to put that fear aside in those moments, because I've had it, and this is real talk for real life. I keep it real with you all. I have been nervous. I have been scared every year that I go for my mammograms and my ultrasounds and my MRIs. I'm nervous, but I think about myself first, right? Because it's about self care. And I think about those who rely on me. And so I have to put that fear aside in order for me to be able to do the things that I need to do when it comes to my health. And so I encourage every woman to put themselves first, put your self-care first, because that's what this is really about. This is about self-care and taking care of you, because if you don't do it, no one else is going to do it for you, right, Lisa? Do you agree with that?
Absolutely, absolutely. I tell people, being a healthcare provider doesn't take away fear of seeking care. So I completely relate to what you shared. When it comes to me, when it comes to whether it's a mammogram, blood work, any sort of imaging, I am very nervous. But I also know that I'd rather know and be ahead of whatever it might be versus ignoring and knowing that at some point or another, it's going to present it in a state where I can't ignore it. So definitely do it fearful. Just do it. There's nothing else to say, right? I can't,
Yeah,
I'm not gonna lie and say, oh, it's amazing to go in and get your breast imaging done. It's amazing that we have access to do that. Yeah. But the
right.
actual process, the nerves, the anxiety that comes with it, we just have to kind of lean on each other and do
Yes.
what we need to do for ourselves, but also those, as you mentioned, who depend on us.
Yes, 100% agree with that, Lisa.
Mhm.
So, for those currently in survivorship, those women who have gone through the treatment and they're here now on the other side, what is some of the ongoing care or support that they should be seeking?
So, when it comes to those brave warriors who made it to the other
Yes.
side, right? So, survivorship is important. And what survivorship looks like for these women would be keeping up with their visits, right? So, keeping up with their, whether it's medical oncology that they have to see on a regular basis, keeping up with their age appropriate screening. So, you may have been diagnosed with breast cancer, depending if you still have your breast imaging will continue, right? If you didn't have a mastectomy, even if you had a mastectomy or breast removal on one breast, you would still have to have imaging done on a regular basis, just the same on the opposite breast, right? And when it comes to other cancer screening, so colorectal cancer screening, cervical cancer screenings, all of those things still are in play, even if a woman has been diagnosed and has gone through treatment. So that's all part of survivorship. So staying on top of their health screenings, staying on top of their specialty visit, and also staying very close to community. I think it's very important for those women to be in community. There are experiences that they've gone through that maybe they don't know too many people close to them that have gone through the same thing. So whether it's support groups or whether it's therapy, however way that would work for them to kind of deal with or into that next chapter of survivorship post treatment.
We here on Real Talk for Real Life are big advocates for mental health therapy. It's okay to need help, right? It's okay to seek treatment from a therapist, a social worker, because, at some point it becomes overwhelming, right? Going through cancer, being diagnosed, and just living life in general, we just need
Yeah.
sometimes, right, Lisa?
Absolutely, absolutely. And you add the stress of just what that woman experienced, the number of
Yes.
doctor visits, the number of treatments, the poking and the probing. There's women who go through breast cancer treatment and develop PTSD from it all. So definitely, we mentioned community is big when it comes to that. And of course, it may look different for every woman, but all of those things are very important.
Yes, thank you so much for that, Lisa. Listen, if every listener took one step this month for breast health, what would you recommend?
My recommendation is get to know your breasts. It
As
starts
simple
with that.
as simple as that.
Get to know your breath. No one knows your breath, maybe yourself and your partner, right? But no
Right.
one knows your breath better than you. And so, without you knowing your breath, how can you expect a provider or a health provider that you see once a year or maybe every other year, or a new provider, let's say someone you're seeing for the first time, to know what's abnormal all the time? Sometimes abnormalities can be very apparent, right? And sometimes they're subtle. And if they're subtle, that's where you come in, right? So my call to action, if I had to leave one word of advice to our viewers, our female viewers, is get to know your breath. They're
I
yours.
love that. I love it. Listen, this is real talk for real life, and it's nothing wrong with being comfortable feeling your breasts, right? Getting to know them, like Miss Lisa said. Listen, this has been an amazing conversation. And before we close out, I just want to add, and becoming familiar with your breast with those breast self exams, it's like, guess what? It's absolutely free, right? And you can do it at any time, right? At any time. And so, again, we want to reiterate, ladies, again, just really learning your breasts and knowing what they look like and what they feel like, because this can make the difference with you seeking treatment and getting those diagnostic exams that you need early on. So I want to say, Lisa, thank you so much again for being here on Real Talk for Real Life. For those of you all who follow Real Talk for Real Life, listen, you must go back to last year's episode on YouTube where Miss Lisa Saintil just really walked us through what it looks like when you are diagnosed with breast cancer and going through the treatment. So don't forget to watch that episode. Don't forget to tell everyone about what we're doing here on Real Talk for Real Life. We're doing some amazing things and highlighting some amazing and dynamic women. If you all want more information, simply email www.womenofdynamicchange.org, and we can definitely get you connected with Miss Lisa Saintil. Lisa, do you have any closing words for us?
What I would say is, first and foremost, thank you, Sherri Ann, for all that you do, your organization. You're making such a difference in the community of women that you have brought together, and the amount of knowledge that you're disseminating, whether it's through yourself alone or with your community of women. Thank you so much. It's so much needed. And with that, I just say thank you. Thank you for having me for the third year. It's always a pleasure whenever I have an opportunity to share with community. I'm here for that, and I appreciate you.
Thank you. And that's why it's so important to have platforms like this so we can honor women such as yourself, Lisa. The feeling is mutual. I thank you for what you do every day. And this is a dedication to all the healthcare providers who are out there in the battle with these women. This is for the family members, right? As well, that are fighting with women who are facing breast cancer. This is to all the women who have survived. This is for all the women who unfortunately lost their lives. And this is for all the women who are currently facing breast cancer and the ladies that will unfortunately be diagnosed with breast cancer. It's all about community. You mentioned it, Lisa. Yesterday, I just want to share with you all before we close out is that I had the opportunity to walk for breast cancer and to just see the commitment of so many people, women and men, and even our pets out there. We had our little pet babies out there, fur babies out there. And so just to see that union of how community comes together to support breast cancer is absolutely amazing. I wanted to say and just give a shout out really to Susan G. Komen because yesterday was just so amazing. And Susan, listen, Komen supports patients and saves lives by fueling innovative research, breaking down barriers to care, taking action for needed policy change, and fostering a supportive community. And Women of Dynamic Change, we stress the importance of community. Like I said before, you can do so much by yourself, but you can do so much more with others. And so we have to remember that. And this is to all the women fighting, all the survivors, and all those who have lost lives. Thank you. Thank you for what you've done. Thank you for what you do and keep fighting. Family members keep supporting and
Mhm.
healthcare workers. Keep doing what you're doing because you are all so appreciated. Thank you all for watching this episode of Real Talk for Real Life. Be sure to subscribe to our YouTube channel. Be sure to tell a family member, a friend, a co-worker about the amazing things that we are doing here and all the amazing and dynamic women who we are featuring every month. Thank you so much. And like I tell you, if it's God's will, you'll see me again next month on Real Talk for Real Life. Take care and have a beautiful Sunday. Bye now.